Hello there. A couple of months ago, I had a major surgery. And when I asked the doctor what the problem was, he told me I had adhesions. And I was like, adhesions? And he said to me, read about it. And I decided to carry out a research on adhesions. And I discovered that 93% of every person who've had surgery will end up with adhesions. What is adhesion? Why is it life-threatening? Well, we'll empower you with that information today so that if you've never had surgery, you probably know someone who's had maybe fibroids, heart, pelvic. And today I have Dr. Amole, Dr. Adeniyi Amole, consultant general surgeon, the Lister Medical Center. He's the man who carried out that surgery on me 2 months ago. Don't go anywhere. We'll be right back. Doctor, you're welcome.
Thank you for having me.
I'm humbled that you found the time in your busy schedule to come here. What's adhesion?
Well, adhesions are basically scar tissues that are formed between two tissues of your body. Basically, once those tissues in their natural state are disturbed, either by radiation, either by surgery, either by trauma, they can develop adhesions. Not just confined to the abdomen, the tummy, but you can have adhesions for the heart. Infection also disturbs tissues. And you have the scar that forms after healing, two tissues now become joined together. Now you have it in the heart. You can even have it anywhere in the body, even including the coverings of the brain to the brain. That's the meninges. So you have it in the heart. You have it to a certain extent. You can have it in the lungs, say after tuberculosis or after some pneumonia. You have adhesions between the lining of the lung and the lining of the inside of the chest wall. And this can cause problems at times. People sometimes have something they call stitch, and they take a deep breath in and they have the pain there until it breaks. They sticking together, it breaks, and then they are free of the pain. So most of the time when you have a stitch, it's because of minor adhesion. But if it's prolonged, they call it pleurisy. That is pleurisy. That is, you keep feeling the pain, especially when you take in a deep breath. That is for the lungs. But the most common place to have adhesion is in the tummy, the abdomen. That's it. So adhesion is really scar tissue between two tissues because of a damage which are taking place within the person's hollow organ.
Okay. When I decided to research it, it was said that it's mostly people who've had surgery, that is healing from a previous surgery.
Yes.
And like the one I had, it was healing from a former surgery that I had. Why is it so life-threatening? Because I remember they had to rush me to the hospital. Yes.
It is life-threatening because if the adhesions, especially in the tummy, if it causes obstruction, that is, the movement of whatever you take from the mouth has to come out the other way.
Yes.
If the adhesion stops it because the tissues are stuck together and somehow or the other it narrows the lumen, then nothing will go through. Sometimes we call it complete obstruction. Sometimes we call it partial obstruction. If it's partial, what happens? The person will still be passing flatus. By flatus, I mean passing gas.
Yes.
If it's complete, the person will tell you in a whole day he has not passed gas. If a person doesn't pass gas in a whole day, something is wrong. Most of us pass gas, you know. The other thing is, depending on the level of the obstruction, vomiting may be added. If it's higher up in the intestinal tract, vomiting will be the main symptom, in addition to the abdominal pain, the crampy abdominal pain, and the patient will be retching and retching. Most of what the patient vomits will be what's in the stomach, undigested food, bile, and one will know it's higher up in the intestinal tract. When it's lower, the patient might go for 2 days without vomiting, but just having crampy pain, and will notice that the abdomen is getting distended and bloated and distended. And at the same time, the patient will not pass flatus, that is, will not pass gas down below. And most of the time, it's the pain that brings the patient to the hospital, because it becomes unbearable and unmanageable at home, and the patient will be brought to the hospital.
How do you diagnose this? How does the doctor
Well, the diagnosis of intestinal obstruction from adhesion is clinical. By clinical, I mean you don't have to do any test, you don't have to do any x-ray. All the other ones are just adjuncts at making you confirm what you suspect or what you know. The diagnosis is made by your examination. The history of the patient will give it away. When you ask the patient questions and the patient tells you how the thing started, what they are feeling and everything, you would almost have made up your mind what's wrong. Then you now examine the patient. You see a bloated abdomen. Having said this, if it's upper up in the intestinal tract, you may not see a bloated abdomen. So an abdomen that is not bloated doesn't completely exclude it. It can still be adhesive obstruction. And therefore, you may think of, oh, it must be maybe just after the stomach because the patient is vomiting. The next thing is you put your hand there and you try to feel the abdomen. Now, for most of them who have adhesion obstruction, you find that they are not as painful as when you put your hand, that is the tenderness. That is, they may complain of pain, but the tenderness you elicit when you put your hand on the tummy is not as bad as those with infection.
Hold the thought. You're welcome back. If you're just joining us, we're talking about adhesions. That's healing from former surgeries could cause scar tissues, right, doctor?
Yes, that's true.
And it's very life-threatening. It's something I went through about 2 months ago. So, doc, you were talking about the tenderness, the vomiting, the distended stomach.
Yes.
And why, before I get to the treatment, it's like you go to the hospital, you have a problem. You go to the hospital to have surgery to save your life. And then you end up with adhesions after surgery. Why? And the adhesions are life-threatening and could end up killing you. And I'm sure in the villages, most people have died. They said the man died and his stomach was distended, which means it's a bit difficult to diagnose. But then, double-barrel question, I know, but you can take it, answer, respond from any point.
Well, the thing is, if you have a condition that requires surgery on your abdomen, not adhesion, for the first time, you will have to do the surgery. I know people who have, for instance, infection of the gallbladder, which we call cholecystitis. You have to do surgery on them. People have perforated ulcer you have to do surgery on them.
Yes.
People have
Ectopic
other
pregnancy.
ectopic pregnancies.
Fibroids.
You have to do surgery on them.
Appendicectomy.
But you know there may be complications from the surgery which you have done.
Yes.
Nowadays, you can do what we call laparoscopic surgery. That reduces the chances of having adhesions. It doesn't totally eliminate it, but it reduces it completely. That is minimally invasive surgery, where you put a camera inside and you use instruments that you just put through keyholes and you use it for the surgery. They can go home, not just that they don't stay long in hospital, the chances of adhesions are less.
But then that depends on the surgery.
It depends
on the type of the surgery.
On the type of surgery.
Not the one you have to bring out the intestine, like you did mine.
Again, there are ways by which you can reduce the likelihood of it happening. You know, you cannot totally eliminate it. One of the things which cause adhesions most is the use of starched gloves. Most gloves we use here are starched to make it easier to put on. First, you can wash them off. Wash the starch off with sterile saline. Yes. That's salt water. The other thing is there are gloves which are specifically made without starch. You can use that, biogel. You can also make sure, so use starch-free, that is no silicone on the gloves at all. Then handle the tissues gently, not in a rough manner. And try not to let the operation last too long. When you expose abdomen to the atmosphere for such a long time, the tissues will dry up, it injures them, they stick together, that sort of thing. So reducing the length of time of surgery, making sure you handle the intestines very well, gently, and making sure that you don't use starched glove. That's it. In the old days, when there is an infection, we used to put tetracycline in sterile water, and we use it to wash the abdomen until it was discovered that the tetracycline itself was causing adhesions. So we had to stop it, that sort of thing.
Is there any study that is being carried out at this time to find out if there's any way adhesions can be completely eradicated?
Yes. It is I'll say one of the leading edges of surgical research is finding ways to stop adhesions. Various chemicals have been proposed that if you pour them into the abdomen, there will be no adhesions. Many of them have failed. There was a time we felt steroids, the use of steroids, which you'll mix with a lot of saline and pour in the abdomen, that there will be no adhesion. But then it was found that it's not true. It's still formed. But certain chemicals are being used. Then the other thing is certain things like films. In other words, you wrap the intestine in films, like cling films,
yes,
special ones made, and it will prevent one from sticking. In other words, you separate them, sticking to one another.
And what happens to the films? They melt?
They melt eventually without the tissues sticking together.
You talked about when suddenly you're in pain and then the pain stops. What's the danger in that?
Yes. If a bowel is giving you pain, it's because it's alive, even though it's doing the wrong thing. Okay. It's doing a bad thing. But when it's dead, there will be no pain. It's just a silent abdomen. And I say that is dangerous in the context of the person who was in severe pain and suddenly the pain just stopped.
You say mine was getting there.
Yours was getting near there, but it wasn't there. It was getting there, but it wasn't that. You know.
At what stage does it become gangrenous?
Yes. You see, the types of adhesions.
Yes.
That is, they sticking together that form the scar tissue are two types. You have the type where the bowel is stuck to one another, and you have the ones that the scar is actually strong and it's like a band, a really thick band.
That's what I had.
That's what you had. And the band can now press down on a loop of bowel. Not just the loop of bowel, but what it does is it also presses on the blood supply to that loop of bowel, which was what happened in yours.
Like
now, when we call it strangulation, you occlude the blood supply to a particular living tissue. Blood cannot go, blood cannot return from it. That tissue will die after some time. So what we did was we resected that bit of the bowel and joined the rest of the bowel together. Thank God it was just a loop and not a very lengthy piece of bowel.
31 inches.
Yes.
That's long.
Hold
the thought,
doctor.
Hold the thought, doctor. Don't go anywhere. We'll be right back.
Thank you.
You're welcome back. If you're just joining us, our topic today is adhesions. What is adhesion? Adhesion happens as a result of healing from a former surgery. It could be in the heart, in the pelvic, in the abdomen. If you've never had surgery, just listen out because you might know someone who's had surgery, maybe fibroid, appendicitis, cesarean section. You're welcome back. Now, Doc, in this remaining moment, is there any advice for people who've had surgery? Because I don't think it's something we know. That was my first time of hearing about adhesions, and it almost cost me my life. Is there any way that before it gets to that point where you need surgery, there are subtle warning signs to enable you know that you have adhesions? Are there any subtle warning signs?
Adhesions happen immediately from day one after the surgery.
So are you saying this one I had was...
It starts forming, from day one. And what happens is this, that the patient would have started having some form of abdominal pain. And what we say is, if you have abdominal pain and you take a liquid diet, once it starts, just take liquid diet for a day or two. Don't take solids. You might avert it turning into something else. It may not come for years, up to 20 years.
Because the surgery I had that caused this, I had it somewhere in 1987.
Yes, but it had been slowly and slowly and slowly pressing down on that loop. It just didn't happen that day until it became such that it occluded it completely. That was when, and it started affecting the blood supply. That was why it became critical at that time.
And became gangrenous.
Yes, and that's it. So what I'm saying is this, that once you start having that abdominal pain, reduce the amount of solid you are taking, take liquid diet. The other thing is, I used to say to patients, try to avoid taking things with seeds, swallowing seeds. Like seeds, like taking a whole
watermelon
orange,
seed,
orange
seed.
All those things in narrowed lumens can actually block them if they pile up together. That's another thing. So, and I used to also say vegetables here, make the leaves rather than the sticks. If you know what I mean.
Yes.
You won't digest cellulose. You won't digest the sticks. And I've operated on people before. I found a lot of sticks of vegetables stuck in narrowed areas. So these are some of the things a person who has problems with adhesions can. And of course, make sure that you don't get constipated. drink plenty of fluids, and that sort of thing.
So
and
this goes for anybody who's had surgery.
Who's had
Since you know you're
abdominal surgery
abdominal
before.
surgery.
Yes.
Since you know it might likely end up in.
Yes, that's the kind of thing. And that's it. Adhesions can cause, in women, the commonest, for instance, pelvic inflammatory disease. When they have an infection, it's adhesions it causes. It can cause even adhesions of the fallopian tube, causing infertility, that is, the egg cannot pass. It can cause adhesions enough to cause ectopic pregnancy. The commonest cause of ectopic pregnancy is adhesions, So adhesions can, not just the bowel, it can also cause problems for women. And that's it. With regards to fertility, with regards to ectopic pregnancy, these are the things.
Doctor, thank you very much. If there's any fallout from this, any questions, I'll invite you. So I hope you'll honor invitation.
For having me.
Thank you. Thank you so much.
Thank
you for your time. I know you've been empowered with information on adhesions. Well, if you've had surgery or you know someone who's had surgery, that person is a likely candidate for adhesions. With all the information you had on this program, what you should and shouldn't do, I believe that you'll be able to save yourself the pain of another surgery in the future. Thank you very much for your time. My name is Yudi. This is the Yudi Factor, and God bless you.